You have to be brave and trust your doctors and nurses and trust that they will do the right things for you.
He is just the most resilient child. He's so tough. Our son Rishi is being treated for acute lymphoblastic leukemia at the Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital.
Rishi had developed some lumps in the back of his neck, and they were just slight bumps. So we took him to the pediatrician, had him check it out.
We were referred to Bristol-Myers Squibb Children's Hospital, and we saw a doctor there.
She ordered a biopsy of the lymph node and of his shoulder where there was pain. She did a great job of organizing 2 surgical teams to do that biopsy at once. A day later, after being discharged, we got the call to say, Rishi has ALL.
One of the first things we had to do that was the hardest was just telling our kids. And a counselor took us through, sort of the initial primer, I guess, on how do you break this to Rishi. And of course, we're thinking of our older son as well. So we came home, we took them to the backyard, and we told them the news. And that was probably one of the hardest things that I've ever done.
ALL is a form of leukemia where your white cells multiply rapidly and start attacking your body.
You just feel like the floor has just been taken out from under you.
It is a numbing feeling. You're in disbelief.
It's a non-tumor cancer, so it's through your blood and your bones.
You want to do the game? You meet with a broad team that's there to support you in many different ways, and if one person can't answer your question, somebody else can. So you feel comforted in that way that you're really being cared for, not only for the body and the patient, but the entire family, and you've got a plan.
The first 8 months of his treatment were, as we were told, they would be very intense, and he went through a lot, physically, emotionally, mentally, and it was really, really hard to watch him go through that.
Your brain gets a bit tired sometimes, you feel really tired, your emotions get uncontrollable sometimes.
Rishi's care is kind of orchestrated between the Cancer Institute and the hospital. The Cancer Institute of New Jersey is where he goes in for regular checkups.
So it would be sort of that office checkup of Rishi by the nurse practitioner, by that hematologist oncologist sometimes, but he would also be administered some forms of chemotherapy there by IV infusion.
He goes to the hospital for bigger procedures or when he had a concern with his health, so be it spike fever or infection.
We probably had, at least 5 hospital admissions.
Really, the 2 teams are separate, but they work well together.
The way they treated just my husband and I was amazing. The way they have treated Rishi is like on a whole different level.
You can't say enough about the doctors, the nurses, the techs, everybody, the housekeeping staff, the people who do transport, they all make the kids feel special.
You go through some pretty harrowing times together with these people, and you bond. And the way that they were there for us during that especially, you go through things with those people at that time that are experiences you don't share with your family, like your extended family. It's just, my husband, myself, and Rishi, and this staff.
It's your home away from home because, we were in there for, at one time for 3 weeks at one stretch. And many times we were in there for a week. To be out of your home and your routine and be somewhere that you can be comfortable is great. We're not patients there, we're part of the family.